My name is Zach. I'll be your nurse today. Would you please state your name and date of birth for me? Check both wrists for wristbands. Okay, everything meshes. And do you have any allergies? Go ahead and raise this up before I raise the bed up. Okay, the patient has no allergies, so we don't have to worry about that. So today we're doing an NG feeding. All right. Go ahead and put some gloves on. And before we get started with setting this tube up, I'm going to go ahead and inspect your abdomen. So if it's okay, I'm going to pull your sheets down, pull your gown up a little bit. So first I'm just going to look for any distension. The abdomen is not distended, so that's good. Next, I will auscultate. Listen in all 4 quadrants to hear sounds. All the quadrants produce a sound between 5 and 35 sounds a minute, so that's normal, that's good. Okay, now I'm going to palpate and tell me if you feel any tenderness or any pain when I do this. No? Okay. Alright, so everything's normal. Alright, so now I'm going to set the patient in a 45-degree, at a 45-degree angle, so we can properly administer this feeding tube and also help with digestion of the feeding going down. So set my blue pad up to catch any liquid that might fall on him. And a little basin with a little cup of water to have him take sips so that he swallows. That'll help the feeding tube go down the esophagus. Alright, so before I administer this, I'm going to grab some lubricant here and lubricate the top 2 inches of the tube. And now the tube is lubricated, I'm going to measure from the ear to the mouth, and then from the mouth to the xiphoid process. And this patient has been measured previously, and the tube should go down to about 45. So I'm going to mark with a piece of tape where 45 is so that I don't go past or too far past that mark. Okay, so I'm going to look in the nostrils. Looks like the right nostril looks a little more accessible. So holding the mark on my thumb where the tube measures from the ear to the mouth, going to start measuring, or start putting in the tube. And while I'm doing this, the patient will have their head flexed towards the pillow. And then when I get to the thumb, or where the mark is right there, I'm going to have the patient put their chin to their chest and push down even further. And the tube should go pretty much to where this tape is. So now that the tube is in place, I'm going to tape it in place. All right, tube is placed in place. Okay, so I have my feeding solution set up in here, and here is some water. So to make sure that we're in the stomach, I'm going to aspirate some of the stomach fluid and grab a pH strip. Put it in my basin here, put a little dab on the pH strip, give it 30 seconds to give me a reading on the pH level of the contents of the stomach that I aspirated. I'll compare it to the scale on the pH scale. Should be between 3.5 and 5.5, and it is, so that has confirmed that I am in the stomach. The NG tube is in the stomach. Now I'll grab a fresh syringe and take the top off. Set this syringe up, and the feeding solution that I have right here, I will first check the doctor's orders to see how much I'm feeding the patient, and I will have already had that measured out. Going to pour this in, not all at once, just kind of gauge the patient's responses to how much you're pouring in. I can hold this higher, and the higher that I hold this, the faster that the tube will feed the patient, and if I lower it, the slower the contents will enter the patient's stomach. So if your patient seems a little bit intolerant to how much they're receiving at that time, slow it down a little bit. If they're not having a problem at all, you can go ahead and lift it a little bit higher. Okay, after you've fed the patient all of that, you want to take about 30 milliliters of some sterile water here and pour it in, just kind of wash all that food down. Okay, now that that's done, I'm going to take some hemostats. I'm going to clamp this tube right here, and I'm going to use a safety pin to go ahead and secure the tube to the patient's gown. Just keep it out of the way. And clean up my area. And before I leave, I'm going to inspect the abdomen, listen to the abdomen in all four quadrants again. Everything sounds normal. Now palpate, make sure the patient still doesn't feel any tenderness or pain when I palpate. Okay, and I'm going to leave the patient in this high Fowler position for at least an hour to make sure that the food is properly digested. But I can lower them, just not lower the angle that they're sitting at. I'll go ahead and lower them to the lowest position. Make sure they're comfortable. Put the call light right here. Is there anything else we can get for you?